Ettema from the University of Applied Science in Utrecht in the Netherlands. And I want to welcome you to the special interest group, the SIC, Evidence-Based Integrated Care. And we have some fine presentations this morning, oral poster presentations. But we start with a small introduction in evidence-based integrated care. You see some names of the group who are in it in the Netherlands. What is integrated care? If we talk about integrated care, it's very difficult to give a definition about integrated care. But if we talk about integrated care, it's an integration of health and welfare services personalized for the patient. So you have to follow the context of each individual patient, and you plug in some content about care or welfare. And if you look at what is integrated care for civilians, then we have some questions. What is the starting point when a client is entering integrated care? What is recorded in a care plan with integrated care? And where is the care delivered? First of all, if we start with integrated care, it starts, of course, with a comprehensive assessment of what is needed, what is this patient or this civilian needs at this moment to participate as much as possible in society. And what is recorded in a care plan with integrated care, all these services which are needed, but in coordination. They have to be coordinated among different providers and settings. And where's the care delivered? Well, at home or as near as possible. So if we talk about personalized care, it's as near as home or at home when possible. So we have some perspectives shaping integrated care. If you look at in the middle, there is integrated care, but it is provided. Policymakers are involved, regulators, evaluators of care, the community, of course, service users, the civilian itself, managers who organize it, and care professionals. And then you see all these arrows, all these lines. And the whole point with integrated care is they are interconnected. And so there are lines between it. And that makes it so very difficult because you have to do it not only in a target group, but you have to personalize it. So that makes it very difficult. And if we look in the literature about integrated care, there's a lot of discussion and there is a lot of debate in defining it and in what we understand about integrated care. But it's, of course, a seamless care provision. And following triple aim, quality of life of the citizens, quality and continuity of care, and cost-effective care. But the problem is if you want to doing research, you want to do research in integrated care, it's narrowed by the lack of a comprehensive definition. So if you look at integrated care itself, it's aimed at well-organized, cost-effective. It must be a process of care delivery, and it must be cost-effective. And it's, of course, provided by committed professionals. And these professionals must count on well-established evidence, of course, for the care they provide, in integrated care trajectories. It's very, very good to understand it are trajectories, it are pathways, care pathways to their patients. So if we are doing research in integrated care, we are doing research in a context. And we are doing research on content of care applied in context. And if we look at the WHO definition, they say, well, let's bring together inputs, delivery, management and organization of services related to diagnosis, treatment, care, rehabilitation, health promotion to improve services in relation to access, quality, user satisfaction and efficiency. This is a definition which is very much focused on the organization of care. But if you look at evidence-based integrated care, it's also about evidence of the content and evidence of the application of that content. And then we come to another definitions. We added the red points with the last years, with many people involved in integrated care. And then we say defining the care problem by identifying working mechanisms. How does things work in practice? Collecting existing effective intervention or develop these. And then we go back to the definition of WHO, which is in black, bringing together input, delivery, management and organization of services. And then we added test acceptance by patient, care providers, the care system, and the rigor of an evaluation study. So it's very much important to focus on that content again and the application of the content. We go back to the WHO definition related to diagnosis, treatment, care, rehabilitation, health promotion, and that's what we added with the group to test the effect of an evaluation study or practice research and or theory research oriented. And then at the end, to improve services in relation to access, quality, user satisfaction, and efficiency, according to the WHO. And we added enabling the working mechanisms of the intervention in the organized context in clinical practice. And then you see there is context and there is content. And that must, you combine that to achieve quality of life and the societal participation of citizens by personalized and cost-effective preventive primary, secondary, and tertiary care. So this is our special interest group on the website of the ICIC. And if you want to join the group or just add something, please be welcome. This is the special interest group, evidence-based integrated care. So we are talking about, and we are doing research in providing evidence on the content, evidence on the application of the content of care in the context of the personalized context of the patient. I want to introduce to you the next speaker. I have to go back. That's